Welcome everybody, all of our friends around the world. Today, what I want to do is to take an honest look at the COVID-19 pandemic, pharmaceutical companies, medicine, and health. We want to examine where we are, where we need to go, and some of the questions that have arisen and try to answer some of those questions. So right now, we are heading into year 3. COVID has already been with us 2 years. We're heading into year 3. The Bahamas and the rest of the world is still trying to cope with all of the issues related to COVID. And it's been challenging, and it continues to change. And, we have a lot of new developments and a lot of new changes going on. And so the question is, what's happening with this COVID pandemic? What does it mean? And what is the role of all of these parties, the health industry, the pharmaceutical industry, and are we approaching it the right way? So these are some of the questions that we're going to deal with. So let's get into it. Right now, we have a new variant called the Omicron variant, and now we have subvariants of the Omicron variant. Let me say at the outset that I am not pro-vaccine, anti-vaccine. I'm not pro or con anything. What I am is I'm trying to find out the answers, the truth, and what works best to put us in the best position to succeed. So when it comes to vaccines, which is probably the first thing that people think about when it comes to this debate about COVID-19, I do believe in the principle of vaccine. I know that vaccines work, and I know that vaccines are important. However, in this particular case, there are a lot of questions. There are a lot of questions about the vaccine. There are a lot of questions about the pharmaceutical industry. Let me give you a few questions to think about. One is that if something is a vaccine, would we know as traditionally successful vaccines, you don't end up taking 4 shots in 1 year. And that's where we're at right now. We're at the point of where you had the first shot, the second shot, you have the booster, and then you have an additional booster. So the question is the vaccine working? Is it really making sense? And I say that because sometimes we get the impression that the vaccine would have solved the pandemic and it would have, taken us into a place where we don't have to think about it. But obviously that's not the case. So what do we do about the vaccine? One of the interesting things that I experienced recently was I went and I visited a few websites. One of the websites that I visited was the CDC website. And I also checked out some websites in other countries. And all of these sites give no information on what to do about COVID-19 other than vaccination. So they say get vaccinated, and then some of the sites would give an indication that, well, if you have a headache, take acetaminophen or whatever. But that's basically it. And what's amazing about that to me is that right now, the vaccine is not stopping transmission. It's not stopping people from getting sick. They are saying that it prevents severe illness and death, but even then, the information is kind of cloudy. So if you have a situation where the vaccine is not as successful as other vaccines, and the new strains are evading them. Recently we had Barack Obama, we had Kamala Harris, Nancy Pelosi, and others all get infected. Most of them said they had mild sickness or not. Some didn't even notice that they had COVID. So in that environment, shouldn't we take a look at if the vaccine is, first of all, working? Is there some future modification to the vaccine that will make it more efficient, make it better? And if the vaccine isn't solving the problem, shouldn't we be telling people what else to do? Let me give you an example. Shouldn't some of the sites say, well, this is about building your immune system, and here are some ways that you can build your immune system? because when your immune system is weak, it means that you are more susceptible to COVID-19. So shouldn't we be telling people, take vitamins, take supplements, go outside, exercise, get fresh air, stay away from certain foods that compromise the immune system, stay away from, eating certain things that science has already indicated impact the immune system. Let me give you an example. Several of the medical professionals that I've worked with, they said to me, Pastor Dave, sugar has a negative impact on the immune system. Too much sugar impacts the immune system. So perhaps we should be telling people in this COVID environment, we should be telling them that, look, here's a way that you can prevent the degradation of your immune system. And here's a way that you can prevent susceptibility to the Omicron virus or the COVID-19 virus. But yet we are seeing very little. One of the things that you've heard me say over and over again in all of these updates is some basic principles. Drink a lot of water, because water is important. Flushing out your system, water replenishes your body. Our bodies are 85% or whatever percent water, and so we need to drink water. The other thing is we need to exercise. Just about all of the scientific data, I have yet to come across anyone in a medical field who says exercise is not good for you. So if we're saying that exercise is important and it helps your immune system, shouldn't we be telling people, exercise, drink water, eat certain foods that are rich in certain nutrients, take supplements, vitamin C, vitamin D, zinc, all of these things that we've been told have a positive impact on your immune system and can cause you to be more healthy. I believe that we should have a multifaceted approach. If the vaccine is proven to work, then you say, okay, get vaccinated. If there are questions and issues about the vaccine, then say, well, okay, those of you who take the vaccine, who decide to take the vaccine, you should still do these things. Those of you who decide not to take the vaccine, you should do these things. And then the other question is, should we be mandating people to take a vaccine when there are so many questions right now? I can't give you the answer. I've looked at the research. Some people are saying, well, the research has proven that it does work, that it does save lives, and even though it's not stopping people from getting sick, and even though the current strain is relatively mild, you should still get vaccinated. I don't know, and it's up to each person to investigate and to determine what makes sense to them. But what's concerning to me is that the vaccine is not working as we would have hoped, and I think we have to admit it. I remember when we had the initial talks about vaccine, I was expecting that, okay, you get a vaccine and then, you don't have to worry about it for 10 years. But now they're saying you get 1 shot, 2 shots, 3 shots, 4 shots, and then we don't know how many more shots you're going to need to get. So that's a bit confusing to me, and it creates a question mark in my mind. The other thing that I wanted to focus on at this point is that there are some questions that I've been asked that need to be addressed. So the question is, the COVID-19, the pharmaceutical industry, the medical industry, the health field. Here's some of the questions that I've been asked and that have come to me in terms of my research myself. One is, I've learned, and I understand this to be the case, that the ones who are doing the studies and the testing for vaccines are the pharmaceutical companies. So you don't have an independent body that is reviewing this information and conducting the tests. You have bodies or regulatory bodies that come along and review what has been done by the pharmaceutical companies and saying, this is okay or not okay. The problem here is that there's a tremendous, I guess you could call it conflict of interest, because the pharmaceutical companies stand to make massive profits based upon the success of these studies. So we would hope that no one would, fudge the information in the study or try to make it more favorable. But when you have this massive financial incentive, the question is, who knows what's happening? And that's a question that I believe needs to be answered. So it's something for us to think about. The other thing that I believe is important is I believe the world and the persons out there who have been impacted by COVID-19 should get the best and most accurate information in order to make decisions. What do I mean by that? Let's say, for example, if the vaccines work, release the information, give details, give all of the background information so that people can be assured. If it doesn't work, then we need to be honest. If you're getting 4 shots in a year, a local doctor told me and an international doctor told me, they said, well, Pastor Dave, I've gotten my vaccine, I've gotten, the second shot, I've gotten the booster, but now I'm at a point where I'm wondering, is there something wrong? Does this make sense for me to keep getting shots of something that is supposed to be a vaccination that relieves me from this issue? So those are real questions that we have to answer, real questions that we have to take a look at. I'm not going to get into conspiracy theories and what's happening and what's behind the background. I'm just, as I said, taking an honest look. And as I take an honest look, I have some honest questions. So what do I believe that we should do? What do I believe should be done? Well, there's several things. I believe that, first of all, we should have a balanced approach. I do not subscribe, I'm at a point where I'm feeling like, based upon the information that's available to me, that people should have a choice. When I say people should have a choice, there shouldn't be a heavy-handed mandate or, I guess you can call it legal demanding approach that everybody gets vaccinated, children get vaccinated, everybody gets vaccinated. I think there should be a choice, and the choice should be based upon information. Some of the research has shown that some young people are ending up with myocarditis, inflammation of the heart, when they take the vaccines. These same young people have very, very little chance of becoming sick or becoming severely ill from the vaccine. So do you mandate it for a group that is in a position where the Omicron or whatever virus is out there, the COVID-19 virus, is not likely to impact them at all? And then there's a question as to whether or not the vaccines are actually impacting them, even though the studies that were published indicated that it may be a very small percentage. But again, have we weighed out the pros and cons to determine, does this make sense? I think these are some of the things that we have to look at. When I talk about a balanced approach, I believe that there should be a lot of emphasis right now on building your immune system, period. What foods, what exercises, what do we need to do to get us in a better position? As you know, in our situation here at Bahamas Faith Ministries, and my situation being a person of faith, I believe there's several things that we also need to talk about that no one seems to talk about. And that is, there are several studies that said people of faith, people who pray, have better outcomes when it comes to medical situations. It goes back to what the Bible says. The Bible says the merry heart does good like a medicine, but a broken spirit dries up the bone. So that tells us that in addition to all of the other things that we're doing, we need to pray, we need to have a right attitude, we need to have a right perspective, we need to laugh, we need to enjoy life, because what can happen is that this environment where people have been sick and dying, and there's so many restrictions and so many conflicts about the COVID situation, that people could have gotten depressed. People, who've experienced loved ones who died, they can become, really anxious about the situation. So I think we need to talk about and make sure that we address spiritual health in addition to physical health. So we have to improve both our spiritual health and improve our immune system, our physical health. I mentioned this in my last update, that there was a study, I believe it was in the UK, that indicated that people who live on a plant-based diet was 73% less likely to be affected by COVID. So if that's the case, that's another consideration. Should you consider changing your diet? A lot of times when you get sick, the doctor tells you, okay, well, don't eat these certain foods, get on this type of diet. Well, if you are changing your diet because you got sick, then maybe you should have been on that diet all along and you wouldn't have gotten sick. So the whole issue of plant-based diets, of eating less sugar, salt, less red meat, or cutting out red meat, all of those things are on the table, because these things can possibly help you with your immune system. Eating whole grains, taking vitamins, all of these things are a very important consideration. Now, as always, it's important to speak with your doctor or your health professional, but sometimes doctors and the medical field in general do not talk about health. They talk about medicine. This is not something that I heard about, it's something that I personally experienced. I went through a health situation where I went to the doctors, I went to the hospital. I had what you would call chronic fatigue syndrome. It made me very sick. It made me feel like I had the flu every day of the week. I went to doctors, I went to hospitals, I had all kinds of tests, I received medications, I received all these kinds of things, and my experience with medicine didn't turn out well. I just got worse. What changed it for me? And this is a personal testimony. What changed it for me was I ran into a nutritionist. And the nutritionist said to me, look, you are approaching this wrong. And I was able to understand that much of my problem came because I was not hydrated properly. I wasn't drinking enough water. And because I wasn't drinking enough water, my system wasn't being flushed out properly. So I had joint pains, I had headaches, I had all of these kinds of things. And I also had a very negative diet. I had a high sugar, high fat diet. So I ended up with high cholesterol. I ended up, with all of these aches and pains, being susceptible to different sicknesses, being sick. And when I learned about changing my diet, it changed my life. So after taking medication for a long period of time, and when I talk about medication, I am not against doctors. I believe in doctors. I go to doctors. But in this instance, what I learned is that the doctors had a medical approach, a medicine approach. They had a pharmaceutical approach. And that may be important in certain situations, but in this situation, it did not help me. What helped me was I changed my diet. I started drinking water. I went outside and exercised more. And as I began to do these things, my health got better. And this is something to consider during the pandemic. Should you make a change in your routine? Should you change your diet? Should you drink more water? When I drank water, I was able to not take any medication and get better. And that was a beautiful thing for me. So I want you to remember that. And it is very important to become informed. One of the things that has been discussed very recently about the COVID-19 pandemic is that without any information on early treatment, a lot of people are staying home and they're getting sick, and they are not doing anything to improve their condition other than taking Tylenol or whatever it is, when there are things that they can do at home. There are early treatments that they can use at home. And those treatments include what I talked about: diet, exercise. There's been some information that I actually got from a local medical doctor where he said, well, you can also use salt and water and a Q-tip, put it in your nose to limit the amount of virus, flush out virus in your nasal cavity and things like that. So it's important to find out what are the early treatments. What do you do before you get to the hospital? What changes can you make? What vitamins can you take? I've heard some of some of the doctors from the CDC and others even talk about they personally are taking vitamin D or vitamin C or whatever it is. And I think we need more information. We need more helpful information that would help people before they get to the hospital. I found that my health improved drastically when I went to whole grains, non-processed foods, not eating fast foods. And these are things that I believe we should talk to people about, because there are people nowadays who are overweight, who are immunocompromised, and we don't tell them, stop eating a certain amount of red meat, stop eating so much sugar, because diabetes, high blood pressure, all of these things are contributors to severe illness when it comes to COVID. So shouldn't we be telling people to address these issues? So these are some of the questions. And the final things I want to say about it is that we have to be careful about extremism on any side. I've seen situations where, people have advocated early treatments at home and they are castigated. I've seen situations where people have been fighting over vaccine or not vaccine, so if you don't take a vaccine, there's a group that's badgering over your head. If you don't take the vaccine, there's a group that's badgering over your head, And so there's this fight going on, and I think it needs to be more balanced. I think people need to get information. They need to make their own choices. We have debate going on about whether or not you should mandate masks or not. I've been told by some medical professionals that the N95 masks are pretty effective. Some of the other masks may not be very effective against the Omicron virus. So it's important to give people information and choices. I don't like wearing masks, but one of the conversations that I had with my doctor, and he said, well, look, this is what we wear when we are going into surgery to prevent us getting infected or spreading infection. So, if I'm using a medical mask that has been proven and doctors are currently using in hospitals, I understand that. It becomes a gray area when you have other masks that even the doctors are saying, well, look, this doesn't really make any difference. So we need to get information and we need to have choices. I'm thankful that the cases have gone down, the hospitalizations have gone down, and there's a lot less worry about Omicron. And so the question now is, unless we get a more severe strain of the COVID-19 virus, should we continue with all of the mandates, demanding that people take a vaccine and so on? These are questions that need to be answered. And like I said, this is about taking an honest look at the situation. I'm not badgering anybody. I'm not getting into an argument, pro, con, or otherwise. I'm just saying, here's some things that we should look at to help us make our decision. I have made my personal decision. My personal decision is I'm taking this opportunity to build my immune system. I'm heavy on that right now. I want to put myself in the best position to succeed. I don't disobey the government. If the government says, these are the mandates in place, I don't argue with it. I would ask questions. If there's a group that's agitating against a particular thing that I'm in agreement with, I may state my case. But by and large, I'm a citizen of the Bahamas. I'm a citizen. I travel. I go different places in the world. And so whatever is in observance in different countries, I respect it and I observe it. I have my own preferences. I would prefer not to have to wear a mask. I would prefer not to have to get all these things to travel and so on. But if this is what is law, if this is what is legal, is this what we have to do, then I have to obey the laws. But I also have to research and determine what is best for me. So I'm doing my research. And as I do my research, I'm finding out information. And as I find out information, I'm making a decision. And I encourage you to do the same. But I encourage you, most of all, make sure you have a good attitude. Make sure you have you take care of the spiritual side of your life. A merry heart does good like a medicine. If you enjoy your life, if you laugh, if you exercise, if you eat right, if you take your vitamins, if you take your supplements, you stand a better chance. So once again, I just want to encourage you to take note of these things and do your best to put your body in a position where your immune system is stronger and you can have a better outcome. We continue to pray that this situation would dissipate, would change, that things would get better. Thank God that things have gotten better. We are praying that it gets even better, and that these strains become milder and milder if they don't go away at all. And at the end of the day, we end up being free to move about as we like, and there are not these restrictions in place. So once again, thank you for watching. Remember, the Bible gives us some very good encouragement. It tells us to renew our mind. So you renew your mind to the Word of God. A merry heart does good like a medicine. Continue to do the things that have made you the person that you are. Follow your convictions. Pray with other people. Give people hope. Give people encouragement. What I've been doing is I've been calling people, talking to people. I've been giving encouraging words every Sunday. I give people a word of encouragement because I'm about inspiration. I'm about telling people the things that God said that will give you a better life. Do unto others as you would have them do unto you. He came that we might have life and have it more abundantly. Faith without works is dead. These are some of the principles. Be transformed by the renewing of your mind. Do not be conformed to the thoughts and the patterns of this world, this corrupted world, the world that's going in the wrong direction. But be transformed by renewing your mind to the good news, the gospel of the kingdom, which gives us hope. It's the thing that caused my life to change, my life to become better, and I believe your life will become better. So once again, thank you so much for watching this COVID-19 update, an honest look at COVID-19, the pharmaceutical profession, medicine, and all the other things that we have to look at. So we look forward to giving you another update probably in a few months. We'll see how things go, and we want to encourage you. Stay strong, stay focused, and keep God as the focus of your life. And remember, the kingdom, Jesus said, thy kingdom come, thy will be done on earth as it is in heaven. So we want the kingdom to come in us so that we can be the best that we can be here on earth. And that's been my motto. That's what's caused me to become the person that I am. So thank you, and God bless you.